Good morning everyone. The topic for today's lecture is tear disinfection and waterline disinfection during COVID-19 era. So we are going to cover this topic under the following contents. So starting with the introduction, on January 8, 2020, a novel coronavirus was officially announced as a causative pathogen of COVID-19 by Chinese Center of Disease Control and Prevention. The epidemics of coronavirus disease 2019 started from Wuhan, China in December 2019 and have become a major challenge in public health problem for countries around the world. On January 30, 2020, the WHO announced that this outbreak has constituted a public health emergency of international concern. The novel coronavirus was initially named 2019 nCoV and officially as Severe Acute Respiratory Syndrome Coronavirus 2, that is SARS-CoV-2. And as of September 2, 2021, COVID-19 has recognized in 216 countries with a total 25 million laboratory confirmed cases and 850 million deaths. Due to the characteristics of the dental setting, the action may be between the dental practitioners and the patient. For dental practices in hospital in the country region that are affected. Now coming to the transmission mode and the impact of dentistry. So the SARS-CoV-2 enters cells through the angiotensin converting enzyme 2, that is ACE2 receptor, found in most cells of the respiratory system as well as the salivary gland cells. Salivary gland cells are believed to be the first site where SARS can be detected, and it is theorized that COVID-19 follows the same path. Similar to the other virus, SARS-CoV-2 is not a living organism and depends on the host cell to replicate. Due to its long incubation period and highly infectious nature, it is very dangerous for the population. So the symptom which includes in COVID-19, the most common symptom as we see is the dry cough, fever, and breathlessness. And the less severe symptoms include the running nose, your sore throat, headache, body ache, and fatigue. Now coming to the route of transmission, as you can see in this picture, the virus can spread in the form of a droplet from one person to the another person, and also it can spread through the dental practice in the form of aerosols and the droplets. Okay, and also it may contaminate, and infected patient can contaminate the surface, and dental professional get affected either by the direct contact through a droplet of the aerosols and by the indirect contact, that is through the contaminated surfaces. So the dental professional should be familiar with how 2019 CoV is spread and how to identify patients with 2019 CoV infection, and what extra protective measures should be adopted during the practice in order to prevent the transmission of the coronavirus. The infection control measures that should be followed by dental professionals, particularly considering the fact that the aerosols and the droplet were considered the main spread route of coronavirus, involves our patient evaluation, hand hygiene, their personal protective measures for dental professionals, mouth rinses before any dental procedures, rubber dam isolation, anti-retraction hand pieces should be used, disinfection of the clinical setting, and the management of the medical waste. Starting with the dental operatory disinfection, starting with the safety or sharp safety. So the recommendation of sharp safety in dental setting by CDC include: you should put all the sharp object in a suitable puncture resistance bag. Do not hood the used needle in order to avoid the accidental injection. It must cover all the sharp object contaminated with patient blood and saliva as a potentially infectious source. Then coming to the instrument sterilization, you should clean all the instrument with detergent and water before sterilization. During washing, it is advisable to avoid splashes of water and wear gloves and face protection. Instrument that penetrate tissue must be sterilized in an autoclave. It is advisable to heat sterilize item that touches the mucosa or to at least disinfect them. The handpiece should be able to drain the water for 2 minutes at the start of the day. Not autoclaval handpiece should be disinfected using a virucidal agent. Then after that, coming to the surface disinfection, it is necessary to always have a perfect protection for the operative room with disinfected surfaces. There are two ways to make the surface aseptic. First, to clean and disinfect the contaminated surface, and to prevent surface from being contaminated by using the surface covers. So the chemicals that are suitable for surface disinfection include the chlorine based compounds such as sodium hypochlorite, your phenolic compound, the water based compound, your alcohol based compound like the ethyl alcohol or the isopropyl alcohol, and the iodoform based compounds. These compounds are used for surface disinfection. In addition to disinfection with chemical, the UVC, that is ultraviolet C irradiation lamp, can be used. The UV light system are used for disinfection has several disadvantages, which include it does not require room ventilation, does not leave residue after use, and has a wide action spectrum in a very short time. The UVC lamp must be activated only when the room is empty, without staff and without patient. The germicidal effect of UVC light causes cell damage, thus blocking the cell replication. The UVC rays are equipped with high energy, which decrease exponential with the increase of distance from the light sources. Object or surface closer to the UVC source will have exposure, therefore will have to organism is directly proportional to the UVC dose received, thus in turn is the intensity and the duration of the exposure. In addition to UVC lights, to encourage the exchange of air, it is recommended to ventilate the room between one patient and the another. If it is not possible to allow the exchange of natural air for at least 20 to 30 minutes, then forced ventilator system with high circulate air, that is the HEPA, must be used, paying attention to the periodic replacement of the filters. Then recommendation for environmental infection prevention and control in dental setting. You have to establish a protocol for cleaning and disinfection of surface and environment of which health personnel must be informed properly. Cover with disposable film all the surfaces that are touched during the procedure, for example switches, and change these protection between each patient. Surfaces that are not protected by the barrier should be cleaned and disinfected with a disinfection after each patient. A medium level disinfected if a surface is visually compatible with blood is used. And according to the guidelines by Ministry of Health and Welfare, India, environment and surface disinfection to be used. For floors, two-step cleaning procedure must be done, first with detergent and freshly prepared 1% sodium hypochlorite with a contact time of 10 minutes. Mop the floor starting at the far corner of the room and work towards the door or major splash or too early. And rest of the surface should be disinfected with a freshly prepared 1% sodium hypochlorite. The contact time for this is 10 minutes. Dusting should be done in straight line that overlap one another. Frequency before starting daily work, after every procedure, and after finishing the daily work. For delicate electronic equipment, it should be wiped with alcohol-based rub or spirit which contains 60 to 90% alcohol before each patient contact. Then patient turnaround and disinfection protocol. After patient leaves the treatment room, the assistant will collect all the hand instruments immediately and rinse them to remove the organic matter and as per standard of sterilized protocol. All 3-in-1 syringes, water outlet, handpieces, water pipeline, etc. should be flushed with the disinfected solution for 30 to 40 seconds. You should remove water container and wash them thoroughly and disinfect with 1% sodium hypochlorite using clean cotton gauze piece and then fill with freshly 0.01% sodium hypochlorite solution and attach back to the dental chair. Handpiece should be cleaned using a handpiece cleaning solution to remove the debris, followed by autoclave pouches for autoclave. Impressions should be thoroughly disinfected before pouring and sending to the laboratory using an appropriate disinfectant solution. And remove the visible pollutant completely before disinfection. Mop the floor with 1% sodium hypochlorite following unidirectional mopping technique from inner to outer. Wash and disinfect the mop with clean water and 1% sodium hypochlorite. Leave it for sun drying. Then dental unit water lines. The outbreak of the waterborne diseases have occurred in a broad range of facilities. The fact that bacteria capable of causing disease in human beings are found in dental water unit waterline is a major reason of concern. The water from the air water syringes and the dental handpieces often has a bacterial level 100 or 1000 times greater than those present in the permissible in drinking water. The type of bacteria that are found in dental unit water lines are frequently the same type that are found in community water, but the level of the bacteria found in dental units are always higher. So the water line for the handpiece tubing should be disinfected. It is used for biofilm formation on the tubing by means of continuous flushing with pressure. The primary source of microorganism in water unit is the public water supply. The saliva can be retracted in the water supply during the treatment. This process is called the suck back. So the non-retraction valve and thorough flushing of the dental line between the patient is to minimize the chance of suck back. So the recommendation for dental unit water quality in dental setting: the use of water compliant with EPA standard for drinking water, and should follow the recommendation for water quality monitoring given by the manufacturer of the unit and waterline treatment product, and should use the sterilized water or sterile saline for irrigation during the surgical procedures. Finally, to conclude, in the face of COVID-19 pandemic, new biosafety measures are necessary to reduce its contagion. So the dentistry is a profession that works directly with the oral cavity and virus and other infectious agent. Because of this, some measures need to be taken to minimize this. In fact, dentists can play an important role in stopping the transmission chain, assuming correct procedures in order to reduce the viral agent diffusion or in promoting undesirable infectious disease diffusion, if operating in adherence to the adequate safety protocols. Dental care professional must be fully aware of 2019 COVID virus and other viral agent spreading modalities. You should know how to identify patients with active infections and most important self and patient protection. Finally, the dental team must consider the overall infective risk level of every dental procedures and respect the new operative protocols that are or will be formulated by the respective national official committees in order to reduce as much as possible the risk of the transmission for the health and safety of the community. These are my references. Thank you.